Hey everybody, this is Dr. Paul Thomas with Plum Health DPC. It's December 2021, and a lot of people don't know exactly what we do, so sometimes it's nice to give an update. We are family medicine doctors. We take care of people of all ages and stages, from children, newborns, to teenagers, adults, older adults, what we would call elderly or senior citizens, people over the age 65. So all ages and stages. And we do a lot of different care for different people. We do continuous care for things like diabetes, high blood pressure, asthma management, chronic care problems for chronic issues that people have. So that's the mainstay of what we do. But we also do urgent care things like sewing up a laceration, or taking care of a fracture, or taking care of an infection like a sinusitis, like a bacterial sinus infection or an ear infection. And I just want to show you an image of something that we did recently. Somebody came in with a splinter. They were working on their home and they were doing some woodworking. Without any gloves, they grasped a piece of wood and they got a splinter into their finger. And so what I did today was I helped this person remove the splinter. I used like an 18 gauge needle. I kind of just go in the epidermis or the dermis, the top layers of the skin, and I use that to gently work out that piece of wood, basically wood splinter. And it takes about 2 minutes, but the patient has a significant amount of pain relief. And also, it happened a couple days ago, so there was some pus, some bacteria stuck in there that created some pus. And when we removed the splinter, some of that pus came out as well. So the thing to do here would be to update the person's tetanus vaccine, so we can do that here as well. We have all sorts of vaccines at our clinic. We have COVID vaccines, we have tetanus vaccines, also known as TDaP. We also have flu shots, so I recommend that everybody gets a flu shot this season because of the pandemic. It's been tough on us as clinicians dealing with the flu, common colds, bacterial infections, and coronavirus infections. So, having a vaccine on board can help us to eliminate some of those as possibilities, or, if they are a problem, they typically are milder. If you get the flu after you've had the flu shot, it's typically a much milder condition. Just like if you get coronavirus after you've had the COVID vaccine and booster, it's typically a very mild infection. So I just want to highlight this one thing that I did today and talk about our services a little bit more. Thank you so much for watching, and have a wonderful day.